Hey everyone, welcome back to all my listeners. Now, I hope you're all having a great day so far. I know I am. And if it's your first time finding me, thanks so much and welcome. Guess what, you guys? This is a perfect time to come on in. This is my 100th episode today. Now, technically, this is my second year of podcasting, and this is episode 13 of my 6th season, but this is my 100th episode of podcasting overall. So I am just humbled and so grateful for all of your continued support in this little niche of medical billing, coding, and compliance. So here's to this little podcast, Paint the Medical Picture Podcast, and its 100th episode. So I'm so grateful for all of the loyalty you continue to give to me episode after episode, because I do put a whole lot of work into these particular sessions. And I love all of the results that pay off from the thousands of downloads episode after episode. This particular podcast does put me in the top 25 business news Apple Podcast charts at least 10 times in the US over these past 2 years, and over 50 of my episodes have been in the top 100 business news US charts on Apple Podcasts. And of course, I do have an international presence and an international audience that I want to shout out to as well, because there are at least 50 countries worldwide that listen to Paint the Medical Picture Podcast. So, hey, I see all of you listening in, and I'm so thankful. Now, I've also made several top charts in international countries as well, like Australia, India, and the Philippines, time and time again. And of course, for these past 2 years, I have been a presence in the top 15 medical billing and coding podcasts in FeedSpot. So I am, again, so grateful for all of this support that allows me to place so well in these particular podcast charts. So, I know there are so many other people that do this. Lots of my friends do this as well, right? In this small niche of healthcare coding and healthcare compliance. So I know there's so many places, so many podcasts, so many voices you can listen to, but I do appreciate when you all tune in to Paint the Medical Picture Podcast every Wednesday when they drop. So thanks so much. Now, welcome, you guys. Today is Wednesday, July 27th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture Podcast series. Now, all right, you guys, I've got so much to get into today. So I'm going to be diving into my compliance tips and my compliance recommendations on the new, hot off the press CBR just being mailed out for Allergy and Immunology Services. And hey, it is the end of the month, right? It's my favorite month-end episode where I discuss highlights from the month of July's criminal and civil enforcement cases involving fraud, waste, and abuse. And I go ahead and round out today's episode with a remarkable quote on vision and leadership by Indra Nooyi. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help all of your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into Newsworthy, the month's fraud, waste, and abuse cases. The month of July saw 34 cases as of the recording of this episode. Early July saw 2 cases related to COVID-19 vaccination cards. The first case saw an arrest of a New Jersey pharmacist charged with selling fake COVID-19 vaccination record cards to individuals who did not receive the vaccine. Now, the second case saw two California men who were both sentenced to 36 months of probation, and they were ordered to pay $500 in restitution after pleading guilty to misdemeanor conspiracy to steal or convert government property charges stemming from the theft of the Centers for Disease Control, that's our CDC, COVID-19 vaccination record cards. And in the plea agreement, both defendants admitted that between March 2021 and August 2021, they conspired to defraud the CDC by agreeing to sell stolen CDC COVID-19 vaccination record cards to others for $50 each. Now, early July also saw a CEO of a North Carolina healthcare company pleading guilty to a multi-million-dollar healthcare fraud scheme. Here, details reveal that she controlled two DME companies that were licensed with Medicare to supply durable medical equipment, that's our DME, to Medicare beneficiaries. Now, this particular DME supplies consisted of products like back, shoulder, knee, and wrist braces. Now, the investigation revealed that this CEO, she caused the two DME companies to bill Medicare for more than $50 million between 2014 and 2021, of which Medicare then paid more than $17 million. She then used these funds to purchase homes and townhomes, in-state and out-of-state, luxury cars like a Porsche and several Land Rovers, and to amass more than $1 million in cash and investments. Now, this investigation showed that to generate revenues, she was paying companies in India and Pakistan to provide her with lists of Medicare patient names and identifying information. These lists of patients were apparently derived from call centers overseas that then contacted Medicare patients to inquire about their need for DME. She then caused her companies to bill Medicare for DME supplies that she purportedly supplied to the patients. And while the CEO and her companies were obligated to have written physician orders to support all of the claims to Medicare, the evidence ultimately showed that this was not the case. And in many instances, she billed Medicare without supporting physician orders and without shipping products, of course, the DME supplies themselves. Now, even when patients receiving equipment in the mail returned the equipment, she did not reimburse Medicare for the returned equipment. The investigation also showed that her companies billed Medicare in the names of some 422 deceased individuals. When audited by Medicare contractors, the evidence showed that she would forge physician orders if no such order existed in her files to support her billings. She has pleaded guilty to a violation of Title 18 of the United States Code, Section 1347, and she faces a maximum of up to 10 years in prison when sentenced later this year. Early July also saw an addiction treatment facility's medical director sentenced in a $112 million addiction treatment fraud scheme. Now, in this case, a Florida doctor was sentenced to 54 months in prison for engaging in a scheme that fraudulently billed approximately $112 million for substance abuse services that were never provided or were medically unnecessary. And according to court documents and evidence presented at trial, the medical director and others admitted patients for medically unnecessary detox services, the most expensive kind of treatment these facilities offered. Now, patient recruiters offered kickbacks to induce patients to attend the programs and then gave them illegal drugs to ensure admittance for detox at 1 out of 2 facilities he served as medical director. Evidence at trial also showed that he submitted false and fraudulent claims for excessive medically unnecessary urinalysis drug tests that were never used in treatment. The medical director and others then authorized the readmission of a core group of patients who were shuffled between the 2 facilities to fraudulently bill for as much as possible, even though the patients did not need the expensive treatment for which they were repeatedly admitted. He also prescribed facility patients a so-called quote unquote comfort drink to sedate them, to ensure that they stayed at the facility and kept them coming back again and again. The evidence further showed that his login was used, with his knowledge, by others to sign electronic medical files to make it appear as if the medical director had provided treatment himself when he did not. Now, mid July also saw a Florida based specialty pharmacy entering into a deferred prosecution agreement and agreeing to pay around $1.3 million in a civil settlement to resolve allegations that it submitted fraudulent claims to Medicare for FWA, which is a high priced drug used in rapid reversal of opioid overdoses. Now, according to admissions in the criminal and civil agreements, the pharmacy dispensed FWA from January 2017 to May of 2018. During that time, FWA was the highest priced version of naloxone on the market, and insurers frequently required the submission of prior authorization requests before they would approve coverage for FWA. This specialty pharmacy completed FWA prior authorization forms in place of the prescribing physicians, including instances in which their staff signed the forms without the physician's authorization and listed the specialty pharmacy's contact information as if it were the physician's information. In addition, the specialty pharmacy submitted FWA prior authorization requests that contained false clinical information to secure the approval for the expensive drug. Finally, the specialty pharmacy waived Medicare beneficiary copayments obligations for FWA on numerous occasions without analyzing whether the patient had a genuine financial hardship. Now, the principal deputy assistant general stated, quote, "Pharmacies, like all Medicare providers, must submit accurate claims," end quote. He goes on to state, quote, "This settlement demonstrates the department's continuing commitment to preventing submissions of false claims by entities at all levels of the healthcare delivery chain," end quote. Now, moving on, mid July also saw a clinical laboratory company in Texas agreeing to pay $16 million to resolve allegations that it submitted false claims for payment to Medicare and other federal healthcare programs. Now, this clinical laboratory provides anatomic pathology services to physician practices throughout the United States. According to the settlement, the clinical laboratory admitted that between the years 2013 and 2018, it routinely and automatically conducted additional tests on biopsy specimens prior to a pathologist's review and without an individualized determination regarding whether additional tests were medically necessary. Now, the United States contends that their policy of conducting routine additional tests caused the clinical laboratory to perform many tests that were medically unnecessary. The U.S. further contends that the clinical laboratory submitted these medically unnecessary tests for payment, causing federal healthcare programs to pay for false claims. Now, a special agent in charge at the HHS OIG stated, quote, "Clinical laboratories are expected to closely follow Medicare rules and bill properly. Nothing more, nothing less," end quote. He later states, quote, "When that obligation is violated, government health care programs and American taxpayers pay the price. We are committed to pursuing these types of allegations along with our law enforcement partners as we work to protect the integrity of our federal health care system," end quote. Now, of course, there were also many, many of the other usual suspects, like more opioids distributors, overprescribing cases, kickbacks, bribery schemes galore, more elder abuse cases, even more DME fraud, and of course, even more clinical laboratories in the hot seat, and money laundering. But I wanted to pay particular attention to a big case that caught my attention. Here, a jury convicts a New York man of $600 million worth of healthcare fraud, wire fraud, and ID theft schemes. Now, according to court documents and evidence presented at trial, this man operated a medical billing company that billed for procedures that were either more serious or entirely different than those his doctor clients performed. Now, he directed his doctor clients to schedule elective surgeries through the emergency room so that the insurance companies would reimburse at substantially higher rates. When insurance companies denied these inflated claims, this man impersonated the patients to demand that the insurance companies pay that outstanding balances of tens or hundreds of thousands of dollars. The jury found him guilty of stealing hundreds of millions of dollars until he was finally exposed by a paper trail that was a mile long, as well as phone recordings on which he impersonated the, all of the Medicare patients, as well as lots of text messages and emails with his co conspirator doctor clients, demonstrating his criminal billing practices. Now, he was convicted of conspiracy to commit healthcare fraud, 3 counts of wire fraud, and 3 counts of aggravated identity theft. Now, he is scheduled to be sentenced at a later date and faces up to 10 years in prison for healthcare fraud conspiracy, up to 10 years in prison for healthcare fraud, up to 20 years in prison for each of the 3 wire fraud counts, and a 2-year mandatory minimum each for 3 aggravated identity theft counts. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. Oh my goodness. Wow, right? So July was another big month of so many varieties of healthcare fraud schemes. But this one I wanted to spotlight at the end is yet another case, right, of a billing company that's in hot water. We've seen that several times over my month-end fraud updates to all of you. I believe this is the third one I've delivered to you over this past year alone. So billing companies are in hot water, people. So I want all of my billing colleagues to pay attention to cases like this. I want physicians, QHPs to pay attention to cases like this. It's incredibly important to remember that we don't know in this particular enforcement action press release that I just disclosed. It's not clear to me when I looked it over if actions are being taken for the co-conspirator doctors that are involved here. So that's unknown, but clearly they went after the billing company leader on this particular case in New York. So it's very, very good to keep in mind. Another big takeaway, right, from this month's spotlight on fraud cases is that this fraud section, right, leads the criminal division's efforts to combat healthcare fraud through the Healthcare Fraud Strike Force program. So it's important to know that since way back in March of 2007, this program is comprised of 15 strike forces that operate in 24 federal districts, and they've charged more than 4,200 defendants who collectively have billed the Medicare program for more than $19 billion. Now, in addition, the Centers for Medicare and Medicaid Services work in conjunction with the Office of Inspector General for the Department of Health and Human Services, and all of them are taking steps to hold providers accountable for their involvement in healthcare fraud schemes. So remember, I also do my very best each and every month highlighting those cases I find most interesting. I try my best to provide some solid guidance where I can and some advice to providers to be mindful of correct coding and compliant billing practices to avoid joining these very serious, these very, very public, and often very hefty outcomes. So I always believe that these types of fraud, waste, and abuse cases are most helpful. So please take a deeper look into these reports and see how they may affect you, your provider, or your facility. Start self-auditing your service claims and coordinating documentation to ensure you are meeting compliance. And now it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to focus on the latest comparative billing report, or CBR, that's been issued on allergy and Immunology Services. Now, this is CBR number 202207. That's right, it is already the 7th CBR for the new year for 2022. So, right now, during the end of July, CMS will be issuing a comparative billing report, this CBR, on rendering providers that submitted Medicare Part B claims for allergy and immunology services. Now, this CBR number 202207 focuses on claims extracted from the Integrated Data Repository based on the latest version of claims available on June 8th, 2022. Now, the analysis includes claims with dates of service from January 1st, 2019 through December 31st of 2019. So that's right, that's one full year of claims. Now, the 2021 Medicare Fee for Service Supplemental Improper Payment Data Report reflects an improper payment rate of 1.9% for allergy and immunology, which represents over $13 million in improper payments. That's a big number. Now, the types of error that comprise the improper payment rate for Medicare Part B allergy and immunology services include a 63.5% improper payment rate attributed to insufficient documentation and a 36.5% improper payment rate attributed to incorrect coding. Now, both of those figures are very big. 63.5% for improper payment due to insufficient documentation and 36.5% due to incorrect coding. Both numbers are way too high. Now, after review of and research into this improper payment rate, this particular CBR was created to analyze the possible threat, of course, to the Medicare Trust Fund associated with allergy and immunology services. So the expectation in this letter that will be outlined to you is that providers who provide allergy and immunology services will maintain proper documentation for patient care and confirm correct coding processes. So the criteria for you receiving the CBR are that you're a provider that has these two things. You're a provider who has significantly been higher compared to either peer group or the national percentages in any of the three metric calculations, which means you're higher or equal to the 90th percentile. And number two, if you've had at least 12 total beneficiaries with claims submitted for the current procedural terminology or CPT codes between CPT codes 95115 and 95199. And finally, third, if you're a provider who has had at least $3,830 in total allowed charges for those CPT codes I just outlined, 95115 and 95199. Now, let's dive into those particular CPT codes further. So these CPT codes that they list out, CPT code 95115, that's defined as professional services for allergen immunotherapy, not including provision of allergenic extracts, single injections. Now let's move on to CPT code 95117. That's defined as professional services for allergen immunotherapy, not including provision of allergenic extracts, 2 or more injections. Then let's move on to the next code, 95144. That's defined as professional services for the supervision of preparation and provision of antigens for allergen immunotherapy. Single dose vials specify the number of vials. And then if we move on to CPT codes 95145 through 95149, that's for the preparation and provision of stinging insect venom for allergen immunotherapy, 1 through 5 venoms. Then if we move on to CPT code 95165, that's defined as professional services for the supervision of preparation and provision of antigens for allergen immunotherapy, single or multiple antigens, and then again, specify the number of doses. And then if we move on to CPT code 95170, that's defined as professional services for the supervision of preparation and provision of antigens for allergen immunotherapy, whole body extract of biting insect or other arthropod. Then if we move on to CPT code 95180, that's defined as rapid desensitization procedure each hour. So for example, that could be for insulin, penicillin, or an equine serum. Then if we move on to the next CPT code 95199, that's defined as unlisted allergy or clinical immunologic service or procedure. And then, of course, they're also spotlighting our office or other outpatient visits, new patients, all 5 levels, 1 through 5. So our CPT codes 99201 through 99205. And they're looking at the same codes for established, those same 5 levels, 1 through 5. And those established codes for the office or outpatient visits are with our CPT codes 99211 through 99215. For example, your letter will identify in a chart, in a table, what your utilization for that specific time frame is. So, for example, what is your utilization of those particular CPT codes for allergy and immunology between that 1-year time period of January 1, 2019 through December 31st of 2019? So for all of your CPT codes that you build out for 95115 through 95199, for example, your letter might have a chart that states that your allowed charges for that 1 year were for $137,000, right? And the allowed units for that 1 year happened to be over 11,000 units that you had billed out. And then that chart will also disclose what your total patients were for that 1 year period. And let's say it happened to be 160 patients. So your particular CBR is going to identify and highlight your specific utilization. Now, the metrics involved here for this particular CBR, they're going to be analyzing these metrics. Number 1, the percent of all claim lines that were allergen injections. Number 2, they're going to be looking at the percent of allergy services that were antigen preparations. And then number 3, they're going to be looking at the percentage of allergen injections submitted within evaluation and management, that E&M service. Now, moving on, this particular CBR analysis is still going to be focusing on those providers who are the rendering providers on Medicare Part B claims for these types of allergy and immunology services. Now, their particular statistics were calculated for each provider, all providers in the specialty and all providers in the nation. Now, the specialty and national peer groups are defined like this. So they looked at the specialty peer group that's defined as all rendering Medicare providers practicing in the individual provider specialty group with allowed charges for the procedure codes included in this study. And then they divided these providers into 3 specialty groups based on the provider's designated primary and secondary specialties within their provider enrollment chain and ownership system, right? Within the PCOS system and within their taxonomy code. So that taxonomy is within that national plan and provider enumeration system. So they broke everything down into these 3 levels. Providers with allergy immunology as primary or secondary specialty or taxonomy are defined with allergist specialty label. And then second, providers with otolaryngology as primary or secondary specialty or taxonomy who are not in the allergist group are defined with the ENT specialty label. And then finally, third, all remaining providers are designated with other specialty label. So they're going to identify you as an allergist or an ENT or an other. Now, the national peer group is going to be defined as all rendering Medicare providers in the nation with allowed charges for the procedure codes included in this study. So now this particular CBR, we have to remember that there are going to be outlining from January 1st of 2019 through December 31st of 2019 that they've highlighted that there have been 23,079 providers nationwide that are listed as the rendering providers on claims for allergy and immunology services. So that total allowed charges for these claims were over $153 million during the analysis timeframe. So they want us to remember that according to the 2021 Medicare fee-for-service supplemental improper payment data report, right? Again, we need to highlight that 63.5% of this improper payment rate was due to insufficient documentation, and 36.5% of this improper payment rate was due to incorrect coding. So, of course, the overall mission of this CBR is to help clarify what the desired behavior here is, right, for all of our allergy and our immunology services. So, they want us to help reduce the possibility of improper payments by taking these following actions. They want us to go over and review all of the CPT code definitions, right, to ensure the correct code assignment. And they want us to be able to perform regular internal reviews, like I always say, and internal auditing, right, of your documentation and code selection to ensure accuracy and compliance before claims are being submitted. So it's critical to just remember that your CBR does not indicate that you're going to get an official audit. Although I've said this time and time again when I talk about the CBRs that are issued at the end of each month. You have to be very mindful that this phrase is directly coming from the MACs that issue the CBRs. So take that with plenty and plenty of grains of salt, because more directly consider this to be your notice. This letter that you received is your warning that you are being looked at closely. But the value of the CBR is still that providers should use it as a tool to look at their own billing patterns as compared to their peers in your state, as well as across the nation. The value also includes the facts that specific coding, guidelines, and billing information will be detailed. Now, this CBR informs providers whose billing patterns differ from those of their peers, right? So again, we want to do much better than this 63.5% improper payment rate due to insufficient documentation and this 36.5% improper payment rate due to incorrect coding. So in my opinion, the letter will be vague, like this one that I just disclosed to my audience, right? So what do I think the deeper nuance is here, right? They're saying that they'll highlight a little more than just the CPT code definition. But I think this particular CBR is quite vague. So it's the insufficient documentation here that's the killer, right? It's at 63.5% of the improper payment rate is for insufficient documentation. So what documentation do I want to see then, right? If I happen to be the auditor doing an internal audit for my allergy and immunology specialists. Well, what I want to see, what I always ask for when I audit these types of providers is I want to see covered indications, right? Like for the conditions which the immunotherapy will be considered medically reasonable and medically necessary. So they will be covered for items like allergic rhinitis and allergic conjunctivitis and allergic asthma and dust mite atopic dermatitis and stinging insect hypersensitivity, like your hypersensitivity to your bees, your hornets, your wasps, and your fire ants. And of course, I'll always want to see what's going on in the treatment plans, right? How long is the buildup phase for? How long is the maintenance phase for? I want to see all that documented in the treatment plan. And then, of course, there's limitations, right? There are limitations that I have to cross-check as well when I'm auditing. Like, these patients should not have any substantial comorbid conditions, right? That could increase their immunotherapy risk. Like, for example, if they have severe asthma that's uncontrolled by their pharmacotherapy, or they have significant cardiovascular disease, or these patients happen to be on beta blockers, or they're on ACE inhibitors, or other meds, right, that must have individualized assessments of risk versus the benefits, right, prior to their receiving any inhalants or venom allergen immunotherapies. And then, of course, these patients should always be able to cooperate during any therapy. So I need to see all of those things in documentation as well. So this CBR should have all of us performing allergy and immunology services really buckle down and self-audit. I just gave you some really good compliance tips and recommendations myself that you won't find in this particular CBR. So, whether we receive this CBR in the mail or not, if you are this type of provider, an allergist or an ENT doing these types of services, it's a good thing to really dive deeper into your own data and beat the payers to the punch, right? Pay attention to what you are sending out the door the first time. Is it really in compliance? So I always believe it's fundamental if you have Medicare as a payer to keep your eye on correct and compliant and coding billing practices and make sure that you are adhering to all of them. It's so important to make sure that your clinical documentation addresses and captures all indications for coverage and you avoid the whopping 63.5% of this improper payment rate that's due to insufficient documentation, as well as the 36.5% that's due to improper coding as well. So, a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coders can then abstract codes with accuracy. And finally, I focus Season 6's Spark on vision and leadership. I want this 6th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for vision and leadership in all we strive to do. So, in this week's inspiring quote in Spark is from Pepsi's former Indian American female CEO, Indra Nooyi. Leadership is hard to define, and good leadership even harder. But if you can get people to follow you to the ends of the earth, you are a great leader. Absolutely true, right? I think this is an amazing quote that reminds us that good leadership is hard to find. I think this quote reminds us that when we find those good leaders, we need to really lean in and listen. This quote inspires us to look deeper. Can we be those types of leaders? I think this quote reminds us that we are the leaders and we are the visionaries in our own lives. We are all most capable of learning from all of our respective and collective environments to become even better. We can strive to become one of those great leaders. I am happy Indra Nooyi's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please have an amazing week ahead and enjoy the last few days of July. Carve out some time for yourselves to unwind and play, or to simply be still. And of course, please continue staying safe and healthy. We are still in a now extended PHE through the month of October. Thank you all so much for listening in on today's very special 100th episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.